the real challenge with engaging our audiences in health policy and health policy advocacy is making it real for them. And so what I like to do is figure out a way to translate what happens in Washington or in state houses across the country to their everyday lives and their everyday practice. Because you have to really paint that picture of how policy drives practice, drives patient care. And so it's really about finding those examples and pointing it out to them and bringing them along. But then in addition, you have to marry that up to giving them hope that they are empowered and able to do something about it. Because all too often you feel like you're just one voice in a sea and that it's very hard to push change or to make change happen in the way that you really want it to. But that's not true. Every voice counts, every bit of energy counts, every bit of voice can move us forward to the world and to the practice environment that we want it to be. For a really long time, community oncology has been mischaracterized as some sort of a lesser site of service. And that's really not true. And we've really never had the data and ability to prove that. So for the first time ever, working with our partners at Flatiron Health, we have taken real EHR data and are looking at patient outcomes, survival curves, and other benchmarks of quality in cancer care, and showing that community oncology is exceeding other sites of service and doing a really fantastic job at taking care of patients. So we're very excited that we're going to be releasing that data at the Community Oncology Conference. And I think it's going to show and showcase the value that community oncology brings to the cancer care ecosystem. It's a little bit of a trick question because everything in the policy environment is impacting cancer care and how providers are able to take care of their patients. The Inflation Reduction Act is an existential threat to cancer practices. It's the #1 issue for the Community Oncology Alliance right now. It threatens to cut cancer practice revenue by upwards of 50%. So practices really need to be paying attention to that because without that extra money, they're not frankly going to be able to keep their lights on. Services payments is not enough for providers to continue operating alone without what the IRA will be cutting. Pharmacy benefit manager behaviors for decades, those abuses have really been impeding the ability for practices and providers to get patients the right care, the right treatments at the right time, in the right place, through, frankly, the right delivery channels, which is the on-site dispensing pharmacy at those practices. And so that, you've got Medicare Advantage challenges and utilization management challenges. Practices are facing all sorts of challenges in the practice environment. And it's what allows that to happen is policy and regulation. You have to understand that what is making it legal and allowing those practices to happen that are impeding your ability to take care of patients is coming through policy. And so practices need to be aware of their entire operating environment, and organizations like COA can help them do that, stay on top of it, as well as give them avenues to engage in advocacy around that, to drive the change and stop the abuses that are hurting their patients.